Greetings, my name is Rusty, and today we're going to talk through how I do dopamine math. Dopamine is a naturally occurring neurotransmitter, and it is the immediate precursor to norepinephrine. That means it stimulates norepinephrine release. Dopamine is produced in two main areas and one secondary area of the brain. The substantia nigra controls the dopamine release, and it affects movements and speech. In the picture on the left, the VTA is the ventral tegmental, and it moves dopamine to that frontal cortex, that feeling of reward. You eat that good food and you get that happy sensation, or you achieve something and dopamine is that happy hormone. And look at the picture on the right. The arcuate nucleus of the hypothalamus secretes that neurohormone of dopamine that sends signals to norepinephrine to release. Norep comes from the adrenal medulla, from that adrenal gland on top of your kidneys. It's direct acting sympathomimetic. That means it affects the sympathetic nervous system. And if you remember, the sympathetic nervous system is your gas pedal. Get you ready for that fight or flight response. Norepi primarily acts on the alpha adrenergic receptors, causing vasoconstrictions. But it does affect the beta receptors just a little bit with that inotropic properties and the squeeze. And we'll talk about those soon. Your alpha responses in your body, you have an alpha 1 and an alpha 2. That alpha 1 is responsible for that vasoconstriction. It's going to take your arterioles and your blood vessels and squeeze them down. That helps increase your blood pressure. With that squeezing down of those arterioles, it's going to increase peripheral vascular resistance and increase preload by sending more blood back to the body. With alpha 2, well, somebody needs to be in charge, so alpha 2 regulates the release of norepinephrine. There are also some beta responses. There's a beta 1 and a beta 2. With that beta 1, you think you only have one heart. With the beta 2, you have two lungs. And that's where each of these betas work in your body. Beta 1 positive effects are positive inotropic, and that's the contractility or the squeeze of your heart. I know squeeze your heart, yeah, I know squeeze your heart. I know squeeze your heart, yeah, I know squeeze your heart. So a positive chronotropic effect is increasing the heart rate. Remember, you time running races with a chronograph back in the day. So chronotropic is time or heart rate. And positive dromotropic is electrical conduction of the heart, increasing the electrical conduction of the heart. So inotropic squeeze, chronotropic rate, dromotropic electrical conduction. Beta 2 properties are bronchodilation. Our bronchioles in our lungs increase in size, they dilate so we can suck in more oxygen because our heart needs it because it's starting to squeeze harder and faster. There's a memory jogger for the beta properties, and that is cardio. C-A-R-D-I-O. The C stands for contractility or inotropic properties. A stands for automaticity, which deals with dromotropic or that electrical conduction in the heart. Contractility, inotropic, automaticity goes hand in hand with that dromotropic or electrical conduction. R stands for rate, or that chronotropic. Remember, inotropic, dromotropic, chronotropic. D stands for dilation of those bronchioles, so we can suck in more oxygen. And you know what? When I start to work harder, I get irritable, and so does your heart. And when I work harder, I require increased oxygen demand. That's why we have that bronchodilation, so we can bring more oxygen to our most important muscle, the heart. Remember the beta properties with the memory jogger, cardio. Next is the dose range of dopamine. That full range is 2 to 20 micrograms per kilogram per minute. The various ranges do various things to the body. 1 to 5 micrograms per kilogram per minute is the renal dose. It may increase urinary output and renal blood flow. From 5 to 10 micrograms per kilogram per minute, it affects the beta properties. Remember, cardio, contractility, automaticity, rate, dilation, irritability, and oxygen demand. Then from 10 to 20 micrograms per kilogram per minute. It's mainly those alpha properties, and that alpha property is mainly vasoconstriction with your dosage range. All right, we need to start gathering our equipment, and we need the right drip set. We want to be precise with our dopamine drips, so we want to use a 60 drop per cc drip set. On the left of this page, we see a 10 drop per cc, and that's saved for our trauma patients. But for dopamine drips and any kind of medication drips, we want a 60 drop per cc set. Dopamine is a weight-based drug, so you need to convert your patient's weight from pounds to kilo. And we convert pounds to kilo by dividing it by 2.2. So let's practice. You need to solve questions 1 through 4 by dividing those pounds by 2.2. Go ahead and pause this video, get a piece of paper and pencil out, or your gadget phone and the calculator function, and work these problems. Ready, set, go. Oh my goodness, did you cheat? You were supposed to work these problems out. I can't believe you just left the presentation running, but let's review anyway. 154 pounds divided by 2.2 equals 70 kilograms. All right, next, 198 pounds divided by 2.2 equals 90 kilos. Number 3, 110 pounds divided by 2.2 equals 50 kilograms. And then a large person, 242 pounds divided by 2.2 equals, what'd you guys get? Are you sure? Yes, you're correct. It's 110 kilos. Nice job. The more you practice, the better you get. All right. There are many versions of how to do drug math, but this is the one I normally use. So by all means, get on YouTube University and discover various ones and figure out which one works best for you. So we do dose times the weight times the drip set over the concentration. Well, we know the dosage range of dopamine goes from 2 to 20 micrograms per kilogram per minute. We multiply one of those doses you choose by the patient's weight. Pounds divided by 2.2 gives us kilos. And then, like stated previously, we want to use a 60 drop per cc set. And then the normal concentrations of dopamine are 800 or 1600 micrograms per milliliter. You divide, or I should say you multiply dose times weight times drip set and divide the concentrations, and that will give you drops per minute. All right, now it's time to practice the whole formula. We know how to convert pounds to kilos, we know the dose range of dopamine, and we know to use a drip set of 60 drops per cc. Go ahead and work through problems number 1, 2, and 3. Pause this presentation and we'll be back in a few minutes. Good luck. Man, I hope you're not a cheater and you just waited 5 more seconds and came right to the review. The more you practice, the better you get and the faster you'll be at dopamine calculations. Let's review number 1. We have a 99-pound patient. You divide that by 2.2 and you get 45 kilos. So we've got 45 times a dose of 10 micrograms per kilogram per minute times a 60 drop set divided by a concentration of 800. That gives us 33.75 drops a minute. 33.75 drops per minute. Number 2, 176 pounds divided by 2.2 equals 80 kilos times a dose of 7.5 micrograms per kilogram per minute times a 60 drop set divided by a concentration this time of 1600 micrograms per milliliter gives us a drip rate of 22.5 drops per minute. And then last but not least, number 3 is a 275-pound patient. 275 divided by 2.2 equals 125 kilos times 5 micrograms per kilogram per minute times a 60 drop set divided by 800 micrograms per milliliter gives us a drip rate of 46.875 drops per minute. I hope you got all those right. All right, rounding rules. On a test, leave the number as is and find the one that's closest to your match. When you're using medications in syringes, we can go to normally a tenth and sometimes a hundredth, which is 2 places after the decimal point, but at least a tenth. When you're doing drips, without a pump, you've got to count the drips. 1 drip every X number of seconds. And guess what? There are no half a drips in ambulance math. So you're just going to use whole numbers the best you can. All right, with your drip counts, you've figured out your drops per minute, but now we need to figure out what's the 1 drip every second. So you take your 60 seconds in a minute, divide that 60 by your drops per minute, and that gives you your 1 drop every X number of seconds. If your drops per minute is around 10, that's 1 drop every 6 seconds. If it's around 20, that's 1 drop every 3 seconds. If it's around 30, that's 1 drop every 2 seconds. If it's around 40, that's 1 drop every second and a half. And that's like looking at the picture on the right side of the page and doing the drop. 1001, 1000, drop. 1001, 1000, drop. That's about a second and a half. And then if your drip rate's around 60, that's 1 drop a second. The golden rule of medicine is do no harm, so it's better to underdose than overdose your patients. And with dopamine, we're going to titrate to the effect. We want to give this med to increase blood pressure and heart rate. So start low, go high with your titrations. All right, everybody loves this slide. In summary, there's your formula. Your dose, 2 to 20 micrograms per kilogram per minute. Your weight, take the patient's weight in pounds divided by 2.2, and always use a 60 drop per milliliter set. Look at your dopamine bag and figure out your concentration. The one in the picture is 1600 micrograms per liter, and make sure you figure out, get your drops per minute. Use 60 divided by that drops per minute to give you 1 drop every X number of seconds. The more you practice, the better you get. During this wonderful presentation, we used these references, so feel free to go in there and learn a lot more about dopamine. I hope you enjoyed it. Until next time, this is Rusty. Have a great day.